So the New South Wales government told an outrageous lie that hundreds of cancer patients missed treatments because of the doctor strikes. As a cancer survivor and a doctor, I'm outraged. Because first of all, chemo is mainly administered by nurses. They're the ones who put on the hazard suits. And let's face it, they're the real doctors in our wards. They keep you safe when you're in hospital. Second, most of those side effects of chemo, they don't happen immediately. They happen 5 to 10 days after chemo starts. Of course, it all depends, dosage and all that kind of thing. So a 3-day strike wouldn't affect that. They could and they had planned around it. And third, doctors care. We would never endanger our patients. Even though we striked, hospitals were on public holiday staffing. So yes, less day-to-day stuff got done, but all key staff were present. I was diagnosed with very aggressive acute myeloid leukemia on May 11th. Chemo started on May 13th. If you needed treatment, you would have gotten it. If you had a reaction, I know for a fact that chemo units, emergency, our most dangerous wards were staffed well. This lie is designed to make you think we're evil, we're greedy, and it's insulting. The government is taking advantage of the fact that we would never walk out completely off the job like others can. The doctors' union, they're asking for an apology from the government, and I think that's reasonable. But the fact is, yes, some people would have missed appointments or surgeries, and that sucks. But this action was necessary for the long term. Because the truth is, New South Wales doctors and nurses are paid the least of any state by a mile, which has led to many leaving or planning to leave. It's led to New South Wales having the least staff to patient ratios. I've got total hip replacement coming up in a couple of weeks. I don't want my surgeons or ward doctors to be coming off 100 hours over 7 nights. I've seen how scarily poorly staffed our hospitals can get. And I work in the North Shore, one of the most well-off areas. My med school friends in Western Sydney have got it worse. Not only are we paid the least, our recent draft bill is making it so specialists can be forced to relocate to anywhere in New South Wales. They can be forced into shift work. They can be fired for whatever. That's why we're losing doctors to other states and to the private system. And we know that if we pay them just similar to what other states do, doctors and healthcare staff wouldn't be leaving. And we know they can afford it. So keep talking about it, keep calling them out, and encourage New South Wales Health, which has kept me alive, to do the right thing. Speaking of doing the right thing, if you're watching this and you work at a hospital, I'm a doctor on a chair, and I also am working on the Google Maps for accessibility called Neo Maps. That'll make it possible for the first time to know exactly how to get in and around a hospital, where accessible bathrooms are, which parking area or entrance you should go to, and so much more, which is so important for people like me. We're already mapping some hospitals. Our tech uses AI and our software to make it very affordable, almost free, to create indoor maps. And I reckon we could get all hospitals in New South Wales digital, navigable, interactive maps pretty damn quick. But anyone can add accessibility info about places for that matter. Check out Neo Maps, start adding information about places right now. And yeah, you can learn more about my story on YouTube, which could help some people too. And yeah, that's me.